Hey Jeremy, how are you doing this week?
Hey, Allison, I'm doing well. How about yourself?
Doing pretty well. Feel like we're getting into the groove of things, this working from home, trying to get things done.
So I've seen a whole bunch of graphics floating around Facebook about like everybody wearing their mask. Like if you wear a mask versus not wearing a mask, like which is like more likely to spread the disease or not spread the disease. You know what I'm
hmm
talking about? Have you seen that?
Yeah, I think, we're in an age of like, there's just so many graphs and infographics out there about related to COVID-19. And I know that's part of what inspired us to start this little bit of series. This is one that I found as we were talking about this helpful illustration, right? And it has some numbers on there.
Yeah, like do we have anything backing this up? Because they say like 85% of statistics are made up. Like I've never seen any actual data backing up any of these things or like any like scholarly studies. Have you seen anything actually backing this up?
No, and it's so interesting, right? Like, of course, I've seen these in my news feeds as I'm scrolling through, the different social media sites, and it seems like this kind of thing is super important and super helpful, right? Like, this is trying to um, convince us to wear the masks with these probabilities, right? Um, but where this information is coming from, where these probabilities are coming from, I genuinely don't know. So as I look at this illustration, I quickly try to find some source, someone where they're getting these numbers from, a study, or even just like an author slash artist, right? Like who drew this? Why do they draw it? I don't know.
Right.
And as I was looking for more of these, I actually found a different one on Facebook. And this one, the Facebook independent fact checkers actually flagged as false information. And if you look, it has the same probabilities and percentages, just the illustration's a little different.
Right.
Um, and that is indicative to me that maybe this isn't great information. It's also interesting that Facebook's algorithm would flag the one version of this, but not the other.
Is
So
it
that
is
shows
this
that
a
we
new
can't always
feature?
trust it. I think it is a new feature, right? They're trying to counter a lot of the misinformation out there. It's really easy to retweet an image or some kind of meme and have it show up as fact. And when we see statistics and numbers, I'm sure you could speak to this. We tend to view those things as true, right? Like they wouldn't tie these numbers to it if it wasn't backed up somewhere.
Right.
So I actually quickly tried to Google this, right? And tried to look into this, and I could not find any research, not peer reviewed, that wouldn't even happen yet, but any kind of scholarship from doctors or any kind of medical authority, public health authority claiming that these numbers are true. I don't actually know where it came from. And I spent a good amount of time digging into this.
Right.
I also found that Reuters and their fact checkers had dug into this as well. And they linked to the multiple versions of this, and it's been shared in many languages. And they ultimately say, very politically, this claim is just not substantiated. We can't
Right.
find anywhere to back this up. That's not to say that wearing the masks isn't important. It's very important. The CDC says so. The European Center for Disease Prevention and Control and the World Health Organization all say we should be wearing these masks.
Right.
But this kind of information is just, it ends up confusing, right? Because as soon
Right.
as someone's able to debunk it, it makes it all seem less legitimate.
Right. Should you not wear a mask now? Like, no, that's not what we're
No,
saying.
certainly not.
It's just maybe be careful about how you're consuming the information. So, would you recommend if I can't find a source, like if it's hard to find an original source or an original artist, like what do you think that means? Do you think that says anything about the graphic? Like, what's your take on that?
I honestly don't have a strong opinion one way or another. Like sometimes perfectly legitimate information is retweeted without the source. That's really unfortunate for the people doing the work in the first place.
Right.
So I wouldn't say that, oh, that's definitely bad or that's definitely good. What I would say is don't retweet that. Don't share that on Facebook until you can verify what you're finding. And probably don't take action on what you're seeing until you can verify what you're finding. And try to do some digging, right? Do a Google reverse image search, start typing in things like, illustration about COVID-19 or whatever, and see what you can find. And lately, there have been a lot of sites, whether it's Reuters, whether it's, NPR, Snopes, a lot of sites with really independent, strong fact checking teams that are looking up this information for us. And, if you can't find it on the internet, reach out to your favorite librarian, whoever that is, whether you're affiliated with a university or a public library. And we're always happy to help find sources for information.
Cool. Well, this was great, Allison. Thanks for that.
Thanks, Jeremy. I hope you have a great week.
All right, you too.